You are listening to part 58 of our series, 7 Medicines, The Wise Woman Way, with Susan Weed at Time Monk Radio. Hello, Susan. Welcome back to Time Monk Radio.
Hi, Gemini. I bet you don't know anybody who's taking any of those kinds of drugs.
I probably know a couple people, but some of those were real tongue twisters. I was keeping up with my notes.
They are real tongue twisters, and that's why they give them such easy to remember names, right? Like Sonata and Lunesta and Ambien and Valium and Ativan and Restoril and Halcyon and Xanax. I especially like the Halcyon. You know, it's like Halcyon days. Oh, everything is going to be great.
Right.
And you know, I've never paid that much attention to drugs, to tell you the truth, because very early on in my life, actually before I was 20, it was very clear to me that I was going to avoid drugs. And that was going to be a lifelong goal of mine, was to avoid taking drugs. And as a fledgling, just a hatchling, a herbalist, I could see that herbs were going to help me to avoid taking drugs. So doing this series for you here at Time Monk Radio has really pushed me to move deeply into a lot of material about what's happening with, well, it's not just a few people that we're talking about here, is it? We are talking about a fifth of American adults and half of American seniors who have difficulty falling asleep. 15% of all adults complain of chronic insomnia. People are anxious. People are having a hard time sleeping. And they go to their doctor and they say, this is what's going on. I need help. And what the doctors can do is to write those prescriptions. And that's what we tend to do. The number of people admitted to benzodiazepine abuse treatment programs tripled in the decade from 1998 to 2008, from about 20,000 to about 60,000. We are probably seeing a rise at least that large right now as well. I'm shocked. I can't even quite describe to you how shocked I am that I am moving through a world in which millions of people are taking drugs that can damage their health in an effort to get more sleep because they think sleep is healthy for them. And it's kind of this circular thinking that I find happening so often with drugs, that will focus on the problem. Sleep is healthy, you're not getting enough, we'll give you a drug, and we won't look at the actual side effects of that, which are not healthy side effects. And I wonder if we're not somehow remembering that the herbs had healthy side effects. So look around you. See what's going on with the people around you. Do they have impaired attention? Are they doing inappropriate things? Is their judgment impaired? Are their reflexes unsteady? Do they walk funny? People will tend to take more and more sedatives, and they will eventually go beyond their established tolerance. And progressively, more and more impairment is going to occur within the brain. Remember that many of these drugs act on the central nervous system. It's no surprise that it increases the risk of Alzheimer's. They were looking to see if it did since it's known that we're taking a drug that is going to impair the functioning of our brains. Complex tasks such as driving and doing fine work will almost always be really messed up eventually by somebody taking sedatives. Memory impairment to the point of blackouts can occur. And in severe cases, there can be stupor and suppression of the respiratory drive, which can actually result in coma or death. Long-term use of benzodiazepines will worsen underlying depression and anxiety. A recent study showed that benzodiazepines accounted for 30% of all deaths from pharmaceutical agents. Again, I just looked at that figure and I thought, what? We're also used to thinking, oh, chemotherapy, it's so bad, we don't want to take it. And yet 30% of deaths from pharmaceutical agents are directly as a result of this one class of sedatives, benzodiazepines, which are prescribed in millions of prescriptions. And 75% of overdose deaths were unintentional. The person taking the benzodiazepine had no idea that that next dose was going to be the one that would cause suppression of the respiratory drive, resulting in coma and death. A study of zolpidem misuse showed that hospital admission was common when sedatives were ingested with other medications and resulted in a great many admissions to intensive care and to prolonged altered mental status. Initial management of sedative overdose includes attention to the ability to breathe and to cardiovascular function. Following stabilization of breathing and heart rate, activated charcoal is given. I liked that a lot. It's pretty easy to buy, activated charcoal. It's easy to have it on hand. If you are taking any sedative drugs, if you know anyone who's taking any sedative drugs, having activated charcoal on hand might be a lifesaver. Certainly, I'm not expecting to stabilize that airway or the cardiovascular function, but I can certainly give the person activated charcoal, and if they appear to be going into a stupor, I could call an ambulance, and that activated charcoal would be the thing that would help prevent their death. So that was something I really grabbed onto in the midst of what to me seems like a lot of pretty frightening information. That, hey, I'm a woman over 65. No, I don't have anxiety issues or sleep issues, but I could. And if I went to a doctor and complained of those things, I would be prescribed one of these drugs. The package insert might say that I could become addicted, but if I took it and I got good results, in likelihood, I would continue taking it. And notice that the side effects become worse with continued use. It's very easy to be addicted, and the side effects worsen with continued use. And addiction means we want continued use. Patients who chronically take sedative medications are at risk for withdrawal syndrome that is clinically indistinguishable from alcohol withdrawal. The severity of the withdrawal will be affected by any other illnesses. Risk factors for severe withdrawal include larger amounts of sedatives, sedatives taken for a longer time of use, older age, and psychiatric problems. Up to 20% of patients who want to stop using their sedative medications develop severe withdrawal. There is significant individual variability. So you may be one of the people who does not have acute withdrawal symptoms, or you may. The clinical features of acute withdrawal syndrome are identical for all sedatives, including alcohol, which is actually a short-acting sedative. Abrupt reduction or cessation of the sedative will always result in characteristic signs and symptoms, including tremor, anxiety, agitation, hyperactivity, elevated heart rate, elevated blood pressure, elevated temperature, sweating, hallucinations, and seizures. The withdrawal symptoms, in fact, are the opposite of the symptoms of acute intoxication. Usually, the initial indication of withdrawal is that the vital signs, heart rate, blood pressure, and temperature go up. Then tremors develop, first in the hands, and then in the tongue, and lastly by gross tremors. Disorientation and mild auditory hallucinations come often accompanied by a full body sweat. Seizures can be a sign of withdrawal and in fact may be the presenting symptom. These symptoms may appear as soon as 4 to 8 hours after the last dose of the sedative and usually manifest within 48 hours after the last dose. But for sedatives with long-acting metabolites, symptoms may not start until 7 to 10 days after the last pill is taken. The withdrawal symptomology of Z drugs is virtually the same as with the benzodiazepines. Cravings, insomnia, anxiety, palpitations, delirium, psychosis, seizures. The withdrawal symptoms for all sedatives usually peak around 5 days. Some patients go on to severe withdrawal. In others, the symptoms simply subside with or without treatment. But it is impossible to predict which patients are going to go on to severe withdrawal. Severe withdrawal means that the sweating worsens, nausea and vomiting occur and can result in aspiration pneumonia. There is delirium with frank hallucinations and rapid severe fluctuation in vital signs going from high to low. Sudden changes in blood pressure and heart rate are going to result in complications such as a heart attack or a cerebrovascular event, also known as a stroke, and certainly elevates the risk for serious cardiac arrhythmias. Progression to severe withdrawal, unless managed by people who know what they're doing, will result in significant morbidity. Taking sedative drugs should be something that we do only as a last resort. The risks of taking sedative drugs are enormous. I have gone into all of this detail about withdrawal because I am hoping that anyone who's listening to this show who is taking sedative drugs is going to withdraw from them. We're going to have 2 or 2.5 shows on herbs that you can start using now and that will see you through your withdrawal. But I want you to understand the severity of what's going on with these sedative and tranquilizing drugs and the fact that you need to be very careful. And this is not necessarily a do-it-yourself trip. Certainly you can get that activated charcoal and have that on hand. Certainly you can have the herbs I'm going to be talking about on hand. But you need to also have a dear friend on hand who can transport you should you need to if you're going to be doing the withdrawal at home, because nobody knows who's going to go on to the more serious, life-threatening part of it. Chronic sedative use may result in a withdrawal so severe that it is preferable to detoxify with certain medication. Benzodiazepines have replaced barbiturates for the management of sedative withdrawal. But for patients who are addicted to benzodiazepines, phenobarbital, or non-benzodiazepine anticonvulsants, and chloral hydrate, which we mentioned last week, are the drugs of choice. Again, this is a kind of scary and almost, to me, very strange thing, that what I'm being told is that if you have been using sedatives for a long time, and remember, a long time is more than 120 days, that's only 4 months, and certainly there are people that I know who have used sleep aids and sedatives for years, that this can cause such severe problems to your body by withdrawing from them that it is better for you to take another sedative to try to come off that sedative. Yes, please do use the herbs that we're going to be talking about. Stable patients who are only taking a moderate dose of a sedative and have not been taking it for too long can taper their dose off over several weeks. Reduce the dose rather than the dosing interval. So if you're taking a certain amount every 24 hours, continue to take it at every 24 hours, but reduce the amount that you are taking. There are pill cutters, there are also pill crushers, which allow you to take not quite the whole dose, a little bit less than the whole dose, and so on, gradually over a period of weeks. It's going down, growing down. For patients coming off short-acting sedatives, a long-acting sedative may be less euphoric and more suitable for helping you. Phenobarbital is preferable to other sedatives for treatment of acute sedative withdrawal syndrome because it has a long half-life of up to 100 hours. There are many, many ways to dose it. It's inexpensive, and there's very little street market for it. A prolonged withdrawal symptom or a symptom rebound will often be seen following long-term use of benzodiazepines. Symptoms of anxiety and insomnia following withdrawal from the use may last for many months. In fact, I found one article that suggested that if you did not want to use another sedative to come off your sedative, that you could try tapering off over an extended time period of 2 to 3 months. So I think we have a pretty good idea here of how we could do it, even if we've been taking benzodiazepines or other sedative drugs for periods of longer than 120 days. We need to get a device that will allow us to take ever smaller amounts and to do that over a long period of months, and to keep that activated charcoal on hand in case any symptoms arise, and to work with some wonderful, wonderful herbs. We have sedative herbs, we have hypnotic herbs, we have narcotic herbs, we have calmative herbs, we have anti-anxiety herbs, we have nervines. Do we have herbs that can be used instead of drugs? The nervines are the ones that nourish and improve the functioning of the nervous system, and these are the exact ones that we would want to start using if we're taking a sedative drug right now. And they would include things like oat straw infusion, red clover infusion, nettle infusion, linden infusion, or tincture of skullcap, mints, and we'll talk about the specific mints, wild lettuce, or California poppy. The nourishing herbal infusions, which you've heard me talk about over and over again, are nutritive herbs that are nervines and help the body deal with withdrawal. I usually suggest if someone's going to be withdrawing from drug sedatives or alcohol, that they don't even start tapering off until they have been drinking nourishing herbal infusions for at least 2 weeks, and up to a month is also very good. Of course, as soon as one knows what's going on, one wants to come off as soon as possible, and yet preparing yourself is a good way of loving yourself and making sure that you're not one of those who slips into that severe withdrawal syndrome. Calmatives are herbs that don't affect the central nervous system, but they tend to ease troubled thoughts. Some calmatives would include chamomile tea, motherwort tincture, milky oats tincture, lemon balm tea, woodruff tea, spruce tea, and tincture of cannabis. Soporifics can help to induce sleep and to induce it gently. Chamomile, which is a calmative, is often thought of as a soporific because it calms us down enough to help us get to sleep. Tarragon tea is an interesting choice as something to help us go to sleep. Poppy seeds are also a wonderful choice, and we'll be talking about poppy as we talk about the sedative herbs, because it's not just sedative, but it is, of course, also hypnotic and narcotic. But the poppy seeds aren't narcotic or hypnotic. They are merely soporific. And it's an old world remedy to heat up a cup of milk with poppy seeds in it and to take that as a nightcap. What a wonderful thing to do rather than to pop a pill. Cannabis tincture, kava kava tincture, St. John's wort tincture, dill or celery seed tea, and spruce, which again you will remember is a calmative spruce tip tea, are all lovely, lovely ways to get to sleep. Hypnotics bring sleep more quickly than soporifics. Those include plants such as hops, wild lettuce, valerian, skullcap, which you will remember is also a nervine, and poppy heads. The sap of the poppy is where most of the alkaloids are found, not in the leaf, not in the root, but in the sap. And that sap is mostly concentrated in the seed head. So while the poppy seeds can be used as a soporific to gently induce sleep, the poppy head, with or without the seeds, is used to bring sleep more quickly, but it is often used as a tea, and it can be pretty bitter. One of my herbal mentors, Juliet Berkeley-Levy, is rather renowned for telling mothers that the best way to soothe a teething baby is to give it a tea of poppy heads. And believe me, anybody is going to fall asleep after drinking a tea of poppy heads. And again, they can be brewed in milk for the extra calming and soporific effect of the warm milk. Narcotic herbs can induce sleep if taken in small doses and can actually kill if taken in large doses. They are not herbs that I am willing to mess with, things like datura, henbane, belladonna, and poppy latex, actually opium. I'm happy enough with the hypnotics and the soporifics. We're going to be talking about these herbs and talking about them in enough detail that you should be able to decide which of them would really be of the most benefit for you. But to finish this week, what I would like to do is to give you a couple of lists that I have gotten together. And they're fairly short lists because I did not want too many herbs on my list. But these are the herbs that are most frequently used and have the most backup both clinically, historically, and through current research to induce sleep. Catnip, lemon balm, cannabis, ashwagandha, chamomile, saw palmetto, lavender, hawthorn, rhodiola, hops, kava kava, mullein, yohimbe, valerian, passion flower, St. John's wort, skullcap, schisandra, and sage. And these are the herbs that are the most successful anti-anxiety herbs. And I want to thank very much the Australian Review, Saris et al., who published this study a mere 3 years ago in CNS drugs, that's Central Nervous System drugs. And the article is entitled Plant-Based Medicines for Anxiety Disorders, Review of Clinical Studies with Supporting Preclinical Evidence. The most successful anti-anxiety herbs were chamomile, skullcap, echinacea, who would have guessed, milk thistle, ginkgo, kava kava, ashwagandha, rhodiola, and two plants that I have never heard of, Mexican thryallis, and a garden plant, which is an ornamental plant called red feathers. Mexican thryallis is Galphimia glauca, and red feathers is Echium ammonum. All the other plants I think you're pretty familiar with, and we're going to be talking about many of them in detail. Herbs that dealt with severe anxiety, especially in people who were experiencing mental difficulties, included sage, lemon balm, passion flower, bitter orange, gotu kola, and bacopa. You may have noticed that two plants that are thought of as being really excellent herbs for these kinds of situations have not been mentioned. Well, they had to mention them. There was too little evidence to include Hypericum perforatum or valerian. So even though valerian is the herbal sleep aid that you'll find if you go to the drugstore, there you'll find at least one, if not several brands of valerian capsules to take, and many people are recommending Hypericum for sleep problems, but this clinical review found that they weren't necessarily useful for anxiety problems. I did appreciate that the review also included psychotropic plants, and they specifically said that there are psychotropic plants that have excellent anti-anxiety effects, and those include cannabis, psilocybin, ayahuasca, and Amazonian chacruna. And Amazonian chacruna, and again, a new plant on me, is Psychotria viridis. The others, I think we can get a little bit closer to. I was just at an herb conference, and they showed us an incredible movie called For the Life of Me, about a woman dealing with cancer and looking to see if cannabis could help her. And she interviewed quite a few people to see what they were finding in their research, and I'll talk about that when I'm back with you next week. Thanks so much for having me, Gemini.
Thank you so much, Susan. And this concludes part 58 of our series, The 7 Medicines the Wise Woman Way, with Susun Weed at Time Monk Radio.